India Alliance and Senior Program Manager in Dementia Care with over 12 years of experience. Ms. D'Souza specializes in non-pharmacological interventions, BPSD management and family counseling, leading multidisciplinary teams to ensure high quality care. I invite you, ma'am, please join us. I would also like to welcome Dr. Steve Paul, Senior Consultant Geriatrics at Apollo Hospital, Banagata Road. He brings deep clinical expertise and is currently an ongoing PhD scholar researching the association between frailty and dementia. Welcome you, sir. I would like all the three panelists to join on the stage so that we can start the panel discussion. We are also live on YouTube, so if anybody whom you know is not able to join can go online and watch the session.
Hello. So good evening, everyone. After the long wait, sorry for the delay in starting the program. There have been a few logistical issues. We will start without much delay. It is World Alzheimer's Day on September 21st, and it's also known as the World Alzheimer's Month. Every year in Apollo, we have sessions to bring awareness. So this time we thought we should have an awareness session that will benefit the caregivers, because the knowledge that a caregiver brings is useful for everybody else. So before we get on to the caregiver story experience, let's hear from our experts, Dr. Satish and Ms. Jyoti, about how to go ahead in managing dementia. A few questions, sir. So why is dementia such a big problem? Is it more than what it was earlier, or is it just that we are more aware of what's happening now?
It's a very good question. What we are talking about now is India is graying. India is graying very fast. What does it mean? That means we are all aging. The aged populations are increasing in this country. And why is it so? It is good. On one side, we have controlled many diseases like infections, many diseases like accidents even, have come down in many of the areas. We are able to conquer the nutritional disorders. We are able to conquer many diseases like heart attack or cardiac ailments, pulmonary ailments, and many, many things. So what has led to is increasing age. Longevity has increased. That means the people are living longer. And when the people live longer, the diseases like neurodegeneration comes up. That means there are diseases which affects the brain, and this affects the brain with brain cells gets affected. When the brain cells gets affected, many of the disorders can come. These are known as neurodegenerative disorders. And among the neurodegenerative disorders, the most common is dementia. Other than that, we have Parkinson's disease, we have motor neuron disease, there are many others. I don't want to dwell on that. But what is important is because of this, the longevity, definitely it is increasing. How do we say that? We can compare from way back in 1990, 1980s, and how it is increasing number. It was expected that by 2000, we would have had 77 million people, 70 million people suffering from dementia in this country. We have even surpassed that. We have 77 million. And it is expected that by 2030, we will have almost 150 million people. So that means it is almost like an epidemic. We are having larger number of cases which are coming up. And it is not a story I see as a consultant in my clinic. When I was in NIMHANS, we used to see cases, and when dementia case comes, I used to call all my students to say that please see this case, this is very important. It was a rarity. So now in my outpatient, a day will not go without seeing at least 2 dementia cases in my clinic, which is a smaller clinic compared to NIMHANS. So that itself speaks volumes. So it is really increasing. And it is not because of anything else. As I've said, that aging is increased, longevity is increased, people are living longer, and naturally we bound to have certain diseases which are known to occur in the aging. So it is said that if you are aged between 60 and 65, your chances of developing dementia is about 5%. On the other hand, if it increases from 65 to 70, it increases to 10%. And by the time you are 80-year-old, it is almost about 40%. And if you are able to survive and go on till 90, it becomes 45%. And it is in 100 years, if a person survives then, his chances or her chances is developing dementia is 1 in 2. It is as simple as that. It becomes 1 in 2. That means because we are graying, because the age is advancing, people are living longer, which is always a good sign. It is a good sign for prosperity, good sign for the country that we are able to conquer many of the diseases which are known to occur and affect the people earlier. But we are landing up with, like in the West, we are also following them, and we are having many diseases which are neurodegeneration, and dementia is one of the major diseases which is increasing now. I'm sure I answered your question.
Like how they say, once you become 80-year-old, you'll either have dementia or you'll be taking care of someone with dementia. That's the higher prevalence, and it may be better to have dementia rather than taking care of a person with dementia. It becomes more difficult taking care. Mr. D'Souza, question to you. Why is dementia not just a medical problem? It's not a medical problem anymore. It's a social problem. And how can you elaborate on that?
Yeah, as sir correctly said, now we have an aging population, more graying, and when the elderly population grow older and older, lot of medical complications will come. So diabetic, vascular, like they have a heart disease and stroke and dementia. So they require caregivers. So when the caregiver required, when the aging population grows, we should have a lot of awareness on that. So how to take care of them? We should have a proper training process, the family carer, caregiving, and their training sessions, and a formal and informal caregiving session should be required to how to help the elders to come out of that. Not only that, as the elderly person grows, there are a lot of fertility, falls, and they have like a rehabilitation comes in. So who will take care of them? The growing population is going higher and high. The younger generation, like younger people will be less. And who is taking care of them? We don't have a support system as such in the, as like a world, what we will take it. And the community as well. So what a stigma we go through. Neighborhood, are we aware about what is dementia? Anybody knows how to take care of the elders when they're unable to walk around? Just will see, look them, and just pass on. So there is no seeking support or raising a voice, support from within the family. There are a lot of challenges come across. Within the siblings, there are a lot of problems. Who will take care of the mother or a parent? They'll divide themselves. A lot of things are there. So all those things has to be addressed. So not only here, caregiving, the burden, the families, how they go through, their emotional trauma, their physical, their mental stability. They go a lot of depression, anxiety, the loss of jobs to look after their elderly person. Sometimes they lose their jobs. The dementia is not easy, but cost effective. Highly cost involved in that. And we don't have any proper insurances or policies to look after them. Any hospitals, if you go, there's no coverage for the dementia as such. So we have to think it all those areas. Medical things also contributes towards elderly population, how to look after them.
True. With dementia comes a lot of medical problems also. The presence of a medical problem can worsen the dementia, and the presence of dementia can alter the presentation of a medical problem, because of which often these patients are not recognized in time. Many of these problems are diagnosed as due to dementia. Sir, in a patient with dementia who you regularly see, what really happens? Is it just memory loss, or are there various clinical features? Do they pass through certain stages? When do they need to be brought to attention?
Yeah. The major issue is dementia is not one disease. It is a group of disorders where the cognitive impairment is one of the component. There are many other components which are involved in that. What all of us know together, so we say that person is 80 years old, he is forgetting the things. That is the only symptom they will come, or they might say. But that is not the only thing. There are many other components along with the memory which comes in the way. Initially, when a patient comes, we always say he is aged, so they tend to forget the things. That is a very, very common way of saying the thing. Because you are aged, you are right to forget the things. Is that so? No, it is not so. There are what are known as some senior moments. We call that a senior citizen have got senior moments. That means we tend to forget certain things. Maybe that I have to suppose to come to the Green Park, I land up in another next hotel and then say that is this a Green Park there? That can occur. That can occur because I am not oriented that I want to come here. I have never seen this place. Instead of going to this place, I go to the next hotel and find out where is Green Park. That can occur. That is not dementia at all. That is a senior moments which there are some people who tend to location, orientation, or this memory in that way can forget. But these are not the ones. But when it advances a little bit more, we tend to forget the things, day-to-day activities. Instead of calling your son, you may call as your brother. You call your wife as your mother. So such things can start coming. Then the problem starts. So we say that this person is not able to do his routine activities, it is coming in your way. Then what we call that as a mild cognitive impairment. There are people with a mild cognitive impairment. That means we tend to forget certain things, but it is still not disturbing all our activities. We are still able to carry out many of the things routinely. So it happens. That is known as mild cognitive impairment, where only the cognition part is impaired. No other activity, no other domain is involved. You may ask a question, what are the other domain? Attention is very important. I need to be attentive first to register. If I know where I am going, what I am seeing, then I can register that and then reproduce that. You have to register to be attentive, you register, then retrieve. You are able to retrieve that. I always give one classic example of my own. I go to a movie because my wife says that we'll go to a movie. I go to a movie, I see a movie, then I come out. You ask me which movie you have gone. I don't know at all. You may laugh at me. Yes, absolutely right, I'm telling you, it is not a fact. It is definitely a fact that I don't remember. So that means I am dementic? No, I am not dementic. But what does it mean? I am not attentive. I was not attentive there to even register the title of the movie. I saw the movie, I enjoyed the movie, I came out of the movie. Finished. There ends my problem. On the other hand, there will be people who can go to the movie, come out and said verbatim even the dialogues. They will be able to tell you all the songs. Their memory is extraordinary, isn't it? No, they are interested in that, they register that and they retrieve that. That is called attention, registration and retrieval. These three are very, very important. When you don't pay the attention, you don't register. If you don't register, you can't retrieve. That is the problem which many of the people at an older age comes to that. As the time passes, attention is gone, then you are not able to register and hence you are not able to get it back. Then some judgment you have to make. You have to make various judgments, and whether the judgment is right or wrong. For example, you want to say that phone call, that number, you take out the phone and then call that number. You take out the phone, call some other number. You don't know that number. When a phone call comes, oh God, this is the number I'm calling? I don't know at all. This is the wrong number. Afterwards we realize. Why does it happen? Then certain decisions you have to take. And that decision you are not able to take at all. And those decisions are simple decisions. Whatever the day-to-day activist decision you have to make, that is gone. That is also slowly going. There is another important function which we have. As the time passes, you do not know, you don't have the illness at all. I don't know, my son brings me here. I don't know what I have. I am perfectly all right. That means what? I don't have insight into my illness. Otherwise, what the patient wants, a patient comes to a doctor or a person comes to a doctor and say, I have this cough for the last 1 week. I have a chest pain for the last 3 days. I have a fever for 2 days. Here the patient comes and says, sits like this. And when we ask the patient, what is the problem? I don't have any problem. And then look at the son, as if the son has brought and or the daughter has brought, and that's why I'm looking at them. Then he says, what? I don't have any issues. He is only telling me all those things. That means they don't have insight into their illness. That insight has gone now. That is the next one which goes. So one by one, the other domain starts going. The cognitive domain is one of the minor things. And then along with the cognition, various other domains also start coming up. Then it is called a global deterioration. When you have a global deterioration of various domains, that becomes dementia. Till then, we don't call dementia. We may call as mild cognitive impairment, mild attention deficit disorder, or you may have aging process which is coming in senior moments. Those are all smaller things. But when it affects multiple area, and then we call that as dementia. It doesn't mean that it is only this which gets involved. There are many others. Many others could be in the form of behavior. Behavior is another major problem. The many people say that he is not behaving well. I don't know what is happening to him. He is now very erratic in his behavior. He talks irrelevantly sometimes, and he doesn't even recognize me, and he starts scolding me, abusing me. Aggressive has become suddenly. I don't know what is happening. This is all happening for the last 3 months or 6 months. What is that is happening? That behavior component has also come in the way. These are the behavioral aspects of it. So not only the cognition, not only the other domains which gets involved, but also the behavior also comes in the way. All these things gets affected in an individual. Of course, in addition to this, you have a physical disability also. It is not only that their gait may be a problem, walking may be a problem, they may not be able to look after their personal hygiene, which is a major concern at that level. They may not be able to look after themselves in the form of the activities like brushing the teeth or taking the bath. All those starts coming one by one. And that is how it starts. I can give one example so that to make illustrate very clearly. I had a patient, I don't mention the names, I don't mention anything. He was a top official in the government. He got retired. And after the retirement, the wife starts noticing that he was a top official, he was able to remember everything. Then she starts noticing that this man has some problem. He goes to the shop. When he gives a list of 10 items, he gets only 2 items and comes back and says that, I don't know which one item you have told me. You asked me 2 items, I brought the 2 items. Then he goes to the post office and comes back, saying that the letter you said to post, I brought it here. So he has forgotten that he has to post that letter. So started that way. And the wife was noticing that a top official in the government retired recently and started doing like this. Initially everybody thought that it could be due to that he was in such a big position that he is now lost in his world, in his own way. That's why he is becoming depressed, and that could be a problem. So it can start like that. Then when the patient came to us, then we were discussing, we were asking, he said that my sleep is disturbed, I'm not interested, I'm feeling dejected now. So straight away we jumped that it is a depression. So he said that okay, he is depressed naturally because he lost all his power now, there is no power, so he is becoming depressed, which is very, very common, especially in the initial stages. Then we said depressed, and we started looking at the detailed psychological evaluation we did, and we asked our psychiatrists to see, psychologists to see. Everybody says that seems to be depression, there is no cognitive impairment. So this was the picture. Then we went on and said that let us see, let us follow up. But he also said at the same time that I am in the board of directors of many companies, and including UTI. He was mentioning that. So then I said, oh God, that becomes much more problematic now. And he says that I am the person who take the minutes of the meeting. So you can imagine what is the responsibility now. So that person writes the minutes also and gives the minutes to, and that will be accepted by everyone. So that is the degree. So how it has started in a small way, then went on as the time passed. The wife started complaining, and we also started noticing that one by one every other domain started deteriorating. And then anybody could make a diagnosis that it was dementia. Why I mentioned this illustrative case is it took almost about 3 years by the time all the features came in. But we don't wait for 3 years to make a diagnosis. We should suspect when we can think in terms of cognitive impairment and whether the patient is going towards that. So there are early signs, early warning signs we should be keeping in mind, and then make a proper diagnosis, and it might require some investigation, and then we can confirm the diagnosis. This is how a story
Right.
to back up my argument.
So, like Hausa said, attention, recall, and retrieval. This is important for remembering what to do. My wife says I've got dementia because I somehow forget everything she tells me. She keeps telling me you've got dementia because you can't remember what I told you yesterday. But like Hausa, if you don't attend to what is being said, you think you have forgotten, and you think you may have a memory problem. Sir also touched upon behavioral issues. In your experience as a psychologist, ma'am, what are the common behavioral symptoms you see, and how have you helped manage them?
In Nightingale's Medical Trust, we have a resident care facility where we have elders, more than 80 people, and we have a memory clinic as well, where the elders comes with the families. The main concerns, first they come for the clinic or a respite admission when they are unable to handle their functional needs. Not the cognitive impairments, most of the displacing things or a confusion, not eating food, there's not a major concern for them. When they have a ADL challenges, unable to brush, unable to undress or dress them or give a bath, personal hygiene is compromised, not sleeping properly, this is take a toll on the family caregiver. Because the families because nuclear families nowadays, people are going to work, kids are going to school. If the one person gets up night, wandering around in the house, get to take a lot of the effort of the entire family on the whole day spending on them. Then they seek the help. And we have the residents there. We'll see the challenges basically when they go to the restroom. They don't understand what to do. They'll go to the restroom, they'll stand there. Should we flush or undress and pass the urine? They should have processed very slowly. The person has to address them, calmly tell them, multiple instruction has to be gone. If they're not able to pass that particular time, we have to give us some more time to get back. And at the same time, food habits, when they're eating food or lunchtime, while serving the lunch, they're unable, don't know what to do. In front of them, the plate will be kept, the spoon will be there, and the water will be there. They don't know how to mix up the sambar with the rice and eat. Some of them has to be mixed everything and has to be fed. The families have faced the challenges, we are unable to feed them. They're not eaten the food weeks together. They only with a liquid diet. We don't know what to do. So when they come here, we'll try to give small quantities. We should not go for the quantity, always give the quality. Intervals, we can give the small intervals, 2 hours, 1.5 hours. Like no one to give a full meals, rice, sambar, chapati, dal he has to eat. No, we has to modify their diet as based on their needs. So they may have a swallowing difficulties, maybe they not like the taste. As the days passes, they are unable to get the taste what they have. Always they have a sweet tooth, we'll tell. In dementia elders, they end with the sweet. Whatever they like at the end, sweet. If you give something added with the food, they likes to eat it. As well as then, apart from that, the thing is agitations. Suddenly they get the triggering point. We don't know what exactly happening. They're very calm and composed, sitting in the group. Suddenly get agitated, started screaming, shouting. We don't know what has happened to them. Maybe the triggering point just passed by someone else. Maybe someone has offered the water for them in that particular time. Or somebody is touched without informing them. We not use any consents. Whenever talking to them, or when you take to the restroom, or when giving the food, we not ask them, what do you want? Just serve the food, eat. Sometimes they do not understand. The communication is a problem, word finding difficulty, the processing, information is a delay. Lot of challenges will be they go through. So we have to have all the sympathy, empathy, calmness we should have. All the carers, family caregivers, as a formal or informal, whoever it is there, we should be a little more polite with them, gentle. Always we need to check with the hard of hearing. Sometimes they don't understand, they are unable to hear. So we'll talk loudly. That's why they repeatedly. We have to check on periodically about the hearing impairments. Vision, are they able to see the plate where we have kept? There's a challenge we come across. So when the person wants to go for the walking, lot of chance of trip and fall. So risk of falls are there. We have to think about it. Mobility issues, slurs wobbling gaits, as well as shuffling gait. These things are to be taken care. That's very, very important at home as well as in the centers where they are taken care. And the environmental, the stimulation, the light, what kind of a light in the room? It is very bright or it is a kind of a little dim. So the sundowning episodes may start off. This is a triggering point for them. Again, evenings, post-lunch, we've seen lot of elders like who in the center. Suddenly they very calm and composed, starts with suddenly screaming or removing their dresses or saying that I want food now, dinner, this is a dinner time, get me food. So at that particular time, we should use our first reality orientation. If person is possible to understand things, if they have an insight. Otherwise, just go along with them, acknowledge their thoughts, their wishes. So going with them, if they want food, you can serve the food. So we should not go argue with them. So these are the areas we look around in the center to handle the BPSDs.
Right, correct. So they have a lot of medical and social issues too, and these behavioral problems are sometimes what brings them to the hospital in the first place. Like how Madam said, medical issues, forgetfulness is brushed aside, thought of as age related. But often a question that's asked to doctors when they come is, sir, gottu idu dementia anta, idike enaದರೂ treatment idya? So how do we manage them, sir? Is there a cure or is there something we need to evaluate when a patient comes with dementia?
See, as I said, that dementia is a group of diseases. It is not that one disease. So we need to find out, first of all, is it a dementia or is it not? That is the first approach. If it is not a dementia, it could be depression. It could be an aging with a minor abnormality. We don't call them as dementia. It could be a mild cognitive impairment. We don't call them as dementia. That is the first and the foremost thing we need to make out. And then comes if the patient has got multiple domain which is involved, including some executive functions which are involved, then we call them as dementia. When we call them dementia, it is not again a one disease. There are different types of dementia. So there are different types which goes with different diagnoses. So each one has got a different disease. For example, a patient has got Parkinson's disease. They may come to us with a dementia. That is a different dementia totally. Then we are celebrating Alzheimer's disease day now, World Alzheimer's Day. Alzheimer's disease is entirely different. Parkinson's disease is entirely different. Then we have another entity called frontotemporal dementia, which is entirely different. And a person has got strokes, repeated strokes, and they come to us with cognitive impairment. That is entirely different. That is called vascular dementia. So each cause is entirely different. So we always look for treatable cause. First thing is, can I treat this dementia? If a patient comes to me, my first concern is, how can I help the patient? Can I help the patient in any way before giving a big label as Alzheimer's disease? The Alzheimer's disease everybody knows, everybody talks about it. But before saying Alzheimer's disease, I want to know whether there are some treatable dementia. And there is a big list of treatable dementia. And one of the common thing as a neurologist we find is a trauma, simple trauma. The patient falls down. You see that yesterday I had a patient. The patient has had some surgery, and following the surgery the patient had suddenly behaving abnormally after about a month. They came to us. We're wondering, and then one-sided they are not moving the limb. So that will not be Alzheimer's disease, definitely. The patient is not able to answer the questions, he is not able to identify their own family member, he doesn't know who is his wife. That is the degree. But what type of problem is this? There is a one-sided weakness is there, which has come only very short duration. It is just for the last 1 month. That will not be an Alzheimer's disease. That will not be dementia. So what we call that as shorter duration, the duration plays a very important role. And neurological deficit plays a very important role. So if it is related with trauma, there is what is known as a blood collection in the brain. We use the word subdural hematoma. So the collection of the blood in the outside the brain itself causes a problem. And that is ably treatable. Once we make a diagnosis, we call our surgeons, and surgeons come and drill the hole and take the blood out, the patient starts improving. It is so simple as that. I had a patient last week for that, and the patient improved and went home. So that is not dementia. Then there are problems with diabetes, blood pressure. These are the diseases which we all know, and the elderly people have many more diseases like this. When diabetes and hypertension is there, we always have to look at that first, then say that this can be treatable. It is related with hypertension. It could be hypertensive encephalopathy. We call that, where there is encephalon involvement, the brain involvement is there. Because of the hypertension, multiple strokes could be an involvement, vascular dementia. Or it could be due to renal problem, which could be there. Or it could be thyroid, hypothyroidism, hypoparathyroidism. There are many, many disorders which can be treated very easily. And there are some treatment, Madam was telling, just gait impairment is there. Yes, there are patients who come to us. We had a yesterday patient who was operated today. A patient had gait abnormality and was not able to remember the things, which is going on for last 6 months to 8 months now. And for the last 1 month, he started passing urine in his clothes. He doesn't know where it is. Because it is only 6 months history or 8 months history. This cannot be an Alzheimer's disease. Usually we think in terms of treatable dementia. So this is another treatable dementia. So we looked at that, and that turned out to be normal pressure hydrocephalus. So when there is a normal pressure hydrocephalus, we can easily make a diagnosis after an MRI, and then started treating him, and then we treated with a small surgery. The patient is recovering. So that is a treatable dementia. Then there are some tumors which can present. These tumors could be there in some parts of the brain, maybe in the temporal lobe or in the frontal lobe. That can be a treatable dementia. So we have a group of diseases which are called treatable dementias. And as a neurologist, as a clinician treating the dementia, when a patient comes to us, we always emphasize on treatable dementias. And when we rule out all the treatable dementias, that means we need some investigations. So most important investigation in such a situation could be, apart from the blood, we do get an MRI done. MRI of the brain is a very important investigation. And once we rule out the tumors, we rule out the blood clot, we rule out that there are no strokes, then we come to a conclusion that whether it is due to metabolic or endocrinal or hormonal disorder. Once we rule out that, then we call that as dementia. And that dementia may not be treatable. So it could be what type of dementia? It could be an Alzheimer's disease, it could be subcortical dementia, or it could be a dementia where the behavior comes up in the forefront, which we call as frontal dementia, frontotemporal dementia. These are the ones where we have certain diseases which can come as frontotemporal only. So why I'm mentioning that is, not all patients who come to us with cognitive impairment lands up as dementia. Not all are Alzheimer's disease. There are many diseases which can be treated, and that is why our aim or objective should be to give chance for these patients to make a diagnosis properly and treat them. If we cannot treat them, if that is not a treatable dementia, then we land up in what is known as neurodegenerative dementia. And when there is a neurodegeneration, then it becomes a problem, because the brain cells are going. And when the brain cells goes by, 60 to 70%, the behavior, the manifestation of cognition, all those things starts. And then we have an issue to tackle. And how do we tackle? Should I mention that now?
So a little about the risk factors of dementia. Who can develop and who cannot develop dementia?
Yeah. The question is asked is, who can develop dementia? I wish I know that answer. But there are certain things which we should be able to find out. The problem are, there are some risk factors. And these are risk factors are modifiable one and non-modifiable one. There are certain modifiable risks which anybody can say: blood pressure, diabetes, cholesterol, thyroid. These are all modifiable diseases which we can modify. Lipidemia, dyslipidemia, all these things can be controlled. We can control the blood pressure, we can control the diabetes, alcohol, substance abuse, smoking. All these are all the risk factors which can give rise to multiple factors which produces dementia. These are called modifiable risk factors. But there are some risk factors which are non-modifiable. For example, there could be genetic. There could be a family history of dementia. In the same family, we may have 2 people suffering from dementia. In such situations, we always look for a genetic causes also. There could be some other causes with ApoE fruit. There are many other substances which I don't want to elaborate here, but those are the substances, those are known associated with dementia. In such cases, they are called non-modifiable risk factors. So modifiable risk factors are the ones which we can modify, a patient can modify, family can modify. Diet, for example, she was emphasizing the diet. Nutritional deficiency, there are many, many conditions which can produce nutritional deficiency. Vitamin B12, if the vitamin B12 is very low, they can produce a dementia-like picture. Then there are infections which can produce, like dementia. For example, a tapeworm infection, even a tuberculosis can produce like this. So these are all various types of diseases which can be treated. So we always look at those risk factors, modifiable risk factors and a non-modifiable risk factor. And modified one, we attempt to do that first. And non-modifiable risk factors like genetic factors, protein factors which are there, I cannot take out that. I cannot remove the gene now, as it stands today at least. Maybe the day may come where we can remove that also. It is not too far away. It happens. It is not a fiction. It is possible now. Genetic disorders could also be modified. It is happening now in many other conditions, in neurology only. So it can come. At this stage, at least we do not have the genetic factors to be treated. So that is why we say non-modifiable risk factors. That is another group of diseases. This is how we always say treatable dementias, then non-treatable dementia, risk factors, with modifiable risk factors, and non-modifiable risk factors. This is how we classify and then treat the patient.
So even newer studies now mention other risk factors could be loneliness, hearing impairment. So these are 2 things we can now at this middle to late life can manage. If you think you have a hearing problem, sort it out, because hearing impairment progresses to or is a risk factor for worsening dementia. And social isolation. We have seen during COVID times, people thought that COVID has caused the dementia, but COVID-related social isolation has often made the dementia in a progressive nature. So sir also mentioned about how dementia is, there are curable types of dementia, the treatable types of dementia, but largely when it becomes neurodegenerative, it is about managing dementia. How do you manage? like how we cannot cure diabetes. This is the example I give my patients. You cannot cure diabetes. You cannot cure some diseases that are probably neurodegenerative, but you can manage them. And how, madam, has the Dementia India Alliance helped to manage patients? How, as a support group, are you there for the patients of dementia?
In Dementia India Alliance, we majorly focusing on urban areas as well as semi-urban, because at least in the cities, at least we have clinics, memory clinics, and geriatricians or psychiatrists. But when you go to the urban areas, we don't have anything. But we have a Dementia India Alliance, we have a toll-free number, and we connect to the people in different part of nation in India, and we get to connect to them, and we are putting the more of the pressure to the, we're working toward closely to the state government, government's policies as well, to come out more panchayat people to work towards that, to have more clinics, encourage more support groups, and with the support group in Dementia India Alliance, people can closely connect each other and express their problems, concerns in the group, and come to the solutions by their own, as well as the expertise, opinions, and we have talks regularly happening and connecting to their solutions on the time. As well as in the rural areas nowadays, in the district level, a lot of programs are happening. The government is taking more of initiatives on that. In each district, they have assigned the clinics and ASHA workers to motivate on the dementia programs, and awareness campaigns are happening to bring out the stigma levels. In Bangalore, at least we have little more awareness and more of clinics are there. But if you go to, apart from Bangalore, other cities, we don't have this much of awareness towards the people. And in the Dementia India Alliance, we have more of connect with the DEM clinic and counseling, and the families, they'll counsel with them. If they have required any kind of a consultation, free of cost, with the experts, they'll connect with them and get into the solution to the families. Because in rural areas and semi-urban people, so required more of support to the families. They don't have any kind of a respite care as such. And the policy has to bring into a lot of people to bring into that. Because as the sir said initially, the graying, in the aging population in 2050, it reaching more than 365 million. So then we have expected more of 1:4 in out of 5, one will be the dementia, elder will be diagnosed. So then we require a lot of care system in place. Training awareness program has to be there. There the Dementia India Alliance is taking place to looking into those areas, more of public awareness programs and making the more memory clinics to setting up the things, a lot of support to the geriatricians to be how to have a more of a training programs to happening all over the nation, and those of programs are happening and day-to-day basis.
So Dementia India Alliance is the organization that helps to connect to the patients. They act as a bridge. So because patients do not know, often they do not know whom to go to. They only go when the problems are beyond a manageable condition. So we at Apollo 2 have formed this Apollo Seniors First, who is part of the organization here. We try and connect to the patient. We become the bridge where the Seniors First connects to the patients at home, so that any problem is brought the attention to the doctor soon, and these problems are helped sort out in a better way. I think we have had an interesting session and a very enlightened discussion. We are happy to take any questions from the audience. Mike, please.
Hello, doctor. My name is Santosh. Just wanted to check to know when actually our parents are categorized as dementia, because when they start forgetting things, do we actually make note of it, or just say, okay, like doctor said, it's just a senior moment where they keep forgetting things? Or when do we draw a line saying, okay, this is a senior moment, or we bring them to? And my second question is this hereditary? Does it come in the family?
So like how sir said, there are senior moments. So there are moments where you may have a mild forgetful episode. There may be things you forget, which may not necessarily be indicative of a neurodegenerative disease. However, when these instances start to affect daily activities is when there are more than 2 domains involved and they start to interact or interfere with the daily activities is when you categorize this person as having dementia. Now, do you wait for that for the diagnosis of dementia? No. The moment you find that things are missing, there are episodes of forgetfulness, it is always worthwhile to halt the disease, halt the progression of the disease. That's when you engage this patient or get him to the attention of a doctor and see what necessary steps can be done to A, diagnose the condition, and to see what are the reversible conditions, if at all it is dementia, what can be done to address it better. Your second question was, sir? Hereditary. So, age is the biggest risk factor of dementia. It is not uncommon for older persons to develop dementia. Usually hereditary dementias start to occur much earlier, before the one reaches an old age of 65 plus. It starts much earlier. But yeah, a parent with a history of dementia puts this child at risk of dementia. But at a very elder age of 85, 90, it's anybody's guess. But there are hereditary types of dementia and they do manifest much earlier.
Hello doctor, my name is Mamata. My mother is 62 and we just found out that she is losing her memory, but we have not got her treated or anything as such, because on daily basis she is good at her activities and certain things she is very good at, and she's got very good memory on certain things. I feel it is only some temporary things she's missing, like what day is today? She asks, okay, today is Saturday, okay. After 5 minutes again she asks. So by the time I start from home to office, 10 times she would have asked. So we don't know about like how to get this fixed. And there are certain things, and some things like her sons, certain things, so she's very good at it. So whenever she does this, no, I tell my father, she's got some problem. No, she's very good. Sometimes she's only acting. You keep quiet here. So how to address this?
It is a very common thing, what you are saying. People ask repeatedly the question, why? Why do they ask the question? That's what we need to think. They are not able to remember that they have asked the question, that you have told the answer. They don't know. For example, you might have asked, what is the day today? And then, or who has come this morning? But they don't remember that. That's why they are repeatedly asking the question. That means they are forgetting the things, or they are not paying the attention to that, and they are not able to register that. Whether they have any other element. You may say that many of my patients say that yes, they remember everything of the past. 10 years ago what has happened, they are able to verbatim, they can say that. Yes, absolutely right. They can remember each and everything what has happened in the past, but they don't know what has happened in the present. They are not living in the present, they are in the past. That is what is the problem. That means they don't know what they have taken in the morning food, whether they have met somebody in the morning, they have forgotten already. But they can talk about when they joined the job, what job they were doing, which place they were there, how many years they were there, when they moved out, all the things they will tell the story. And that is very, very important. And this is very important part of an early cognitive impairment. And that is why we need to look at such patients in detail, whether they have cognition which is impaired and whether it is a cognitive disorder. That is what is important. Sometimes they may not paying the attention, as I gave the example earlier. So that could be the reason. But if it is happening repeatedly, that is every day such things are happening, then you need to get examined by a neurologist or a psychiatrist or a cognitive specialist who can make a proper diagnosis.
We can take one more question for want of time.
So this early stage treatment can be done. Means like my father, he is 76 and he got a stroke. And after that, I have seen some changes. Like he will forget every day he is having medicine, but he will depend on my mother. Like last 7 days I was taking care. My mom went out of station. So I'll tell morning you have to have these 2 medicine. Again next day morning he'll ask like I need to have this. He is doing daily routine like taking bath and all everything he is doing, and food also proper. But that weakness is there after stroke. He is not energetic. He can't walk for a long time. And this is treatable or because I feel it is early stage, and is it treatable or how it is, or it is going to increase going further?
You said he had a stroke recently.
Yeah.
When was that?
It was last 3 months, 4 months back.
Yeah. Whenever such an event happens, recently like a stroke, you must think that whether it is related to that. or not related to that? If it is related to that, what was the type of the stroke? The first question I asked. The reason is, in the stroke, there are many parts of the stroke. One of the part is the speech and the language. And the speech and the language is a very important component. If a person cannot understand, we say that he is not answering properly. For example, you might ask me, what is your name? I say, I am from Bangalore. What does it mean? That means I am not understood the question which you have asked. You have asked me my name, but I am telling I am from Bangalore. So there is no connection at all. Or you might ask me another question, which is of day-to-day activity, but I may say something else totally. That is not dementia. That is a part of the speech and the language disorder. What we call as a receptive component. That means in the speech, there are two components. One is I have to understand what you have asked. Another one is I have to express. That is called expressive part and a receptive part. If I don't understand what you are asking, then I cannot answer your question at all. And then you may say he is wrongly answering. He is telling something which is irrelevant to me. But he talks very fluently. That is the problem. That is not dementia. It is due to speech and the language problem. And that is why I asked the question, when was the stroke? And what was the type of the stroke? Where was the stroke? Which part of the brain is involved? All these are related. And if it is due to the language and the speech problem, as the language and the speech improves, they also get better. That is what is important. And whenever there is a vascular component, like a stroke, it is treatable. It is treatable, if not fully, partially at least we can treat them. That is what we look for.
So they kill the weakness, sir? Means like
we need to assess the patient,
okay.
and after assessing the patient, a neurologist, if you approach, they will be able to assess the patient, and if they have the speech and the language problem, then there are speech and language experts are there. They will be able to help you out and then see that how it can be improved. That is what is important. It may not be dementia at all. That's it.
Thank you.
Yeah, just adding to that, when you're having difficult, because he asked him multiple times, should I take the medications or not? So you can make a timetable for him or a chart, make a diary, note it down every day. So because he understands things, at least he can go back to refer the book. So he will have more personal, he can check on that, not to come to you as an alarm, like a clocks. You can set up the time and tell him to take on time. That will be helpful him to do individually by himself. Give more independence, self-motivation, it will get him to him also. For you also, it will more helpful to reminder by himself to do things.
Thank you, Dr. Satish.
One question, one thing I wanted
Yes,
to
sir.
comment on. So one thing I wanted to comment on. We always use one slogan, use the brain or lose the brain. That is very, very important. That means we must make use of our brain. If you don't use our brain, you will lose the brain. So what does it mean to you? That means you must be actively engaged in using your brain in day-to-day activities. A person says that I'm not interested, I'll just sit in one place and don't look at the television is on and I'll be sleeping here. That is a very, very common symptom which we see in elderly people. So what we should tell them is you must be attentive, you must use your brain. How do I use the brain? There are many activities one can perform. So I always say medicine is only a part of the disease. What we give or what we prescribe. You are all interested in getting, can I cure my dementia? Can you prescribe a drug? No, the answer is no. The answer is you must, other than the drug treatment, you have a non-pharmacological treatment. What is known as non-pharmacological treatment is more important than pharmacological treatment. What does it mean? That means I have to be engaged in activities which can build the networks in the brain. It is like building the blocks. It is building the networks inside the brain. How do I build it? There are many activities which you can do daily which can help. For example, I say always my patient, do you play chess? They say, no, I don't know the chess. Do you play carom? They said, some people say yes. Do you play card games? Say yes. If nothing is known, I say, do you know dice? Pagde ata. So do you know pagde? They say, yes, yes, I know that is a very old disease. No, 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 that is very important. Now it is very important because you start playing Pagde with them. You ask the person to move the coin. That is what is very, very important. How does it help? It helps because it builds the network inside the brain. That is very important. Then you also say Sudoku. You know Sudoku games. You should ask them to do. Then I always ask a person, do you have a small children in your house? How old are they? They are 15 years, 16 years people. Then learn the computer game from them. They all play always the computer game. Some intelligent computer games are there. These computer games can be adapted and given to them, ask them to learn. Sir, I don't see that at all. I can't see. My vision is gone. Hearing is all right. If hearing is all right, I can help you. If your hearing is also gone, now I have to supplement first the hearing, then the vision, and then I will give you a keyboard, or sorry, I will give you a, what is that, iPad. iPad I will give you, and put it on the iPad, the big way, and any font can be increased. You increase the font and make them read. So that is the way you can do. And they have to read the paper. For example, a newspaper. Sir, this person reads from cover to cover the newspaper. But I don't want that cover to cover. What I want is whether what he remembers. That is what is more important. So I always say, okay, he reads the newspaper. Does he remember anything? We don't know, sir. So the best thing is a son or a daughter has to ask some questions on the news. What is the current news today? So he said that I have not read the newspaper. Go read the newspaper, come back, at least tell me 2 headlines in the newspaper. 2 headlines is enough for me. So that means he has to read, he has to remember and retrieve and tell me that. So that involves a lot of steps involved there. And that is what exactly we emphasize there. And this has to be done. A television is there, we are watching a news. The news is coming. At the end of the thing, you ask me 2 news, at least 2 headlines, important news, what is going on. I ask the patients every day when they come to me. They say, I have not read the newspaper today. Don't bother. Most of the people will say that. Yesterday you have read? No, no, I don't know. Then don't bother about it. What is the news which you know, you tell me. So that person may say, some news which has happened, Ladakh war. That means when? 1 year ago. So that person may be talking about that. Or the person may say, GST was removed yesterday. Then I know that this person knows everything. Or Asia cricket, Asian Cup is going on now. That means that person is very currently involved. So this is how we link up and then say that this is what needs to be built up. And that can be built up by giving this. I always say that Antakshari, you can play Antakshari among yourself and then say, or few questions, simple questions I will say, can you tell me 5 pet animals? That's all, 5 pet animals. They start, oh yes, I know, dog, cat, then afterwards stop. Nothing more will move on. So which is the 3rd pet animal? So they don't know. So you have to give the clue to them and ask them to get it out from them. Like that you can say. This is almost like reversal of age. What I say is the reversal of age means like a child, how you treat a child. You have to treat the elderly. It is exactly like this. Only difference is a 5-year-old kid will become 6-year-old. Here, 5-year-old will become 4-year-old. And a 4-year will become 3. 3 will become 2. 2 will become 1. That is unfortunate. So that is how it is regression occurs and the patient may not know how to look after their personal hygiene as the time passes. And that is called the reversal of aging. To make the patient's family member to understand this, I gave this example. And with this example, for example, you go with a small child. You go out, take the child out. Will you leave the child and go? No. You will always carry the child. Take the child in the hand. Similarly, elderly require support. You have to carry them. You have to tell them. And then you show, there is a board. You see that board? That was a restaurant, I used to go there. They see this restaurant name. So you have to tell them. You have to tell them this is the restaurant. This is a very famous restaurant earlier. This was called MTR and it was there for more than 100 years now. Similarly, what I'm giving you an example, like a child, you have to treat them and you have to look after them and educate them, create the interest in them, which is a very, very important. One important thing I ask them is, do you have any hobby? They will say, yes, my hobby is singing. The lady says that I always sing Vishnu Sahasranama or some bhajans. So then I tell them, okay, you can get any music nowadays, it's very easily available, old or new, and then put that and then ask them which raga is this, who has sung this song. Balamurali Krishna has sung this song, or it may be M.S. Subbalakshmi has sung this song. You can say that. Or he is interested in a cricket match. So who is the captain of the Indian team now? Or who was the captain earlier? Whom do you know? He says Tendulkar was the captain. You know that which year was it? Long, long back. Like that it is. So you need to educate them, and create interest among them. Whichever the area they are interested, you can build it up. And when you build up, you are building the blocks, building the network inside the brain, and that produces better improvement in the cognition. So not just the tablet, just the tablet or the treatment which you are looking for. The non-pharmacological method is equally important, but that depends upon how much time you can spend. And if you don't have time, the Dementia Alliance type of institutions are there, they will support you. So that is the reason the Dementia Alliance and many other organizations, Nightingale is there, there are many organizations like this where you will be treated like it's a small child, bhajans, you asked to sing the song, solve the problem, solve the puzzles. These are the things which you can do. That is very, very important, by which the network develops and the improvement occurs. That is how it is the dementia which is treated, not by just by pharmacological method, but by other non-pharmacological method. That's what I just wanted to say. That.
So in the past few minutes or maybe an hour, we've been discussing about what is dementia, what is not dementia, what can be done, how it can present, and what are the different stages we go through, and how do we manage them better. Like how Sir mentioned, use it or lose it. God has created us in such a way that if you don't use your brain, you tend to lose your connections. Watching TV or watching Instagram reels or WhatsApp videos are not using the brain. Often patients will, I keep watching my phone. That's not using the brain. That's probably the worst form of engagement. Reading, writing, playing caroms, which Sir says. And one thing I often tell my patients is, do you have children at home, younger children? Because I used to tell my dad, my father all the time, invest in your grandchildren. They are the ones who are going to take care of you. If you have a grandchild with you staying in the same house, you're lucky. You can get to play snake and ladders with them, Ludo with them. Your son will not have the time, your daughter will not have the time. So connect these two generations together. It will be beneficial to both. We have had a very fruitful discussion. Thank you, Satyasandra sir. Thank you, Mr. D'Souza. Thank you all for a good listening.
Thank you again, Dr. Satish Chandra, Dr. Steve, and Ms. Asha for that incredibly insightful discussion. The panel has illuminated two critical takeaways for us. First, that dementia care is fundamentally a holistic effort, requiring not just clinical diagnosis, but also personalized non-pharmacological strategies. And second, that effective management relies on establishing consistent routines, managing behavioral and psychological symptoms with empathy, and leveraging a multidisciplinary team from neurology to geriatric medicine and clinical psychology. We truly appreciate the medical insight and the human touch you have shared. Thank you so much. As Maya Angelou once said, people will forget what you said, people will forget what you did, but they will never forget how you made them feel. This is truly what the spirit of dementia care is. Now we have with us Dr. Govindaya Ratish, Vice President and Unit Head, Apollo Hospitals, Bangalore, guiding force behind this initiative. I now invite Sir to deliver the inaugural speech and set the tone for a program, Compass Navigating Dementia Together, organized by Apollo Seniors First and Apollo Hospitals, in valuable association with the Indian Academy of Geriatrics, Karnataka chapter and the Dementia India Alliance. Sir, please.
Namaste. First of all, I'm not prepared for this. I think the interaction is by the clinicians and the support group. But having said this, when Dr. Steve has put it across, and knowing the disease and the disease burden and what is really needed for the society and the community, keeping that, I said, sir, first please let us do it, because the burden currently at this point of time, it's about 5 lakh people who are living in Karnataka is what I Googled myself and find out. In next 10 years, it's going to be double that. So look at what is that one side patient, other side family, and other side caregivers, and we all need to as we're all going to be get aged, who's going to look after us? So all of us have our own selfish responsibility, our selfishness, we need to create this society, nurture this society, this community, and this support group to take care of our elders. So that's the reason Apollo has always thought about this and put across seniors first. So if you don't take care of our seniors, who will look after us? So that's with that, I'm very grateful to everyone, taken your time out, spending and sharing your valued experience for building this community. I am really grateful to each one of you, and thanks for participating, particularly the whole team putting this across and also making this thing to be taken live online and so that reach to larger group. This whole thing has been recorded and it should be disseminated, the information should be disseminated so that larger group need to be bring the awareness. That is the fundamental thing about bringing them together, bringing intellectuals together, the society will get benefit. That's the whole thing what we are doing. Thank you so much, each one of you, for coming here and be part of this initiative. Thank you.
Thank you, sir. Now we turn to the heart of today's program, the voice of caregivers, my journey, caregivers' perspective. So families and caregivers are the backbone of dementia care, and their stories are filled with courage, resilience, and unconditional love. I would like to call Mrs. Chitra Krishnamurthy, whom I have known for quite some time now. She has been taking care of her husband, who is diagnosed to have dementia and is very brave and exceptionally taking care of him very well. I would like her to share her experience with all of us.
Can I speak from here? Sure. No, it's okay. Good evening, everybody. This is such an august crowd. I'm actually a bit scared to stand in front of you and tell you. When he was diagnosed, it was given the diagnosis was Lewy body dementia. That was the first time I heard that word. So immediately went inside and Googled, learned articles, everything. At the end of it, it all said, each individual is so different that only you will find a way to deal with them. Okay? So what is the point of reading so many things? And when it comes to bravery, no, I'm not. Now only I know why men marry much junior girls. Because we have a difference of 10 years between me and my husband. Now I know that he is at an advantage because I'm 10 years younger than him. But that doesn't mean that I am not old. I am 74 years old. So it's like, how long can I pull on? And dealing with one issue cannot be done similarly the next time. Every time the same issue has to be dealt with differently. What actually I have benefited from that is my brain has become sharper. I can think of so many other ways of, distracting him and getting him out of that mood. Sometimes, Dr. Steve Paul calls it sundowning. I say it is Chitra downing. Because, at 2 o'clock in the morning, he gets up, puts all the lights in the house is lit like a Christmas tree, and then, he is moving around. So I get up and then he says, there is so many people are there, why don't you make coffee? It's like, you know what? You are seeing everything with your Gyan eyes. I have only, human eyes. I can't see them, There are so many people. And who will make coffee? I said, definitely not me. When you invite people, you should tell me. It's like that, make the conversation lighter. And at all this, one thing is very important. Please don't lose your sense of humor. If you cannot laugh at those instances, it becomes very difficult for you to deal with. That is one thing I have, to keep myself sane, I need to retain my sense of humor. So everything, and there have been times when I have laughed, and he says, why are you laughing at me? I said, no, I'm not laughing at you. I'm laughing at something you did. Not that it is going to make a big difference and he's going to understand or anything. It's just that, Actually, when I do all these things, I do it for myself. I don't do it for him. Because for him, he doesn't suffer. That is the only redeeming feature in this dementia. They do not know. They are not suffering. So as long as you are the person who suffers, it's fine. That's what you can do for your loved one. Every day I'm learning. Every day, each situation is different. I have help. I have a boy who takes care of him fully. It all started with when he was able to do his own things by himself. Now, he needs help for a bath. He needs help for, changing dress, everything. I play cards with him. You said, I play cards with him every day. And then, at some point, some 3 deals later, he says, you're cheating me. So it's like that. Yeah, now at least you know I'm cheating you, right? That's good, isn't it? At least you know you're cheating and then somebody is cheating in the card and all that. But later I realized that was not because he knew I was cheating. He wanted to call it off. That was one reason to say, I'm not going to play anymore. It goes like that. So anybody who is dealing with this will have to learn on their toes. You stand on your feet, you sit, react. While you are doing that thing, you react. It's not always that you have to go along with them. There are times when you can tell them, see, look, whether you understand or not, this is the truth. So even if you are going to take time to understand it, please take all your time. I'm not going to play along this. Because sometimes that kind of playing makes us insane. You are not able to deal with a lot of things, which is suddenly life throws at you. First, when he was diagnosed, I was in denial. Because he was one person, top quality professional, who did everything right. Like exercise, reading, socializing, everything was fine. He was one of those perfect guys. I always used to feel, I'm so imperfect. But well, he ended up with dementia and I seem to be talking here, no? There is such a big difference in that. So first I was in denial. Then doctor threw me a lot of things. He gave me articles to read and stuff like that. Then I realized, okay, this is what is this now? And I better gear myself up so that I can deal with it. So far, so good. I don't know what is tomorrow. I don't know what it holds for me. I just want to take care of him as much as I can. And I would do it with all vigor and energy, as long as I retain that energy. Later, I don't know. We don't know what is tomorrow, isn't it? So later, I don't know. But right now, it's not easy. It is definitely not easy. You lose one part of your personality to adapt to somebody who is dealing with the best part is he doesn't know that. He doesn't know that he has a problem. So actually, that is actually good in a way that, at least I don't have to keep telling him, you know what, you have dementia. You have Lewy body dementia. What is Lewy body dementia or dementia or whatever it is? The condition is the same, isn't it? All called in different names. Anyway, thank you for teaching me Lewy body dementia. Okay, anybody who's dealing with elders in the house, don't lose hope. There is always hope. There is always, and every individual can always rise up to the occasion. You think that you can't manage, but when the situation comes, you definitely rise up. And younger people can definitely do it. So don't lose hope. As long as we are able to carry them along, we'll do it. One day, you just throw your hands and say, no more. Then Nightingale is there. You can always put them in an institution where they'll be taken care of. And I was wanting to tell one thing about people dealing with the dementia patients. You better get a tracker. It is always better to have a tracker. I have one. I make him, whenever even he is going for a walk inside the compound, I make him wear that. And I have the app in my phone. So you can track where they are. That is very important because in case, that boy goes along with him, in case they go out of the gate, then it becomes difficult for us to find out. Always have a tracker. That helps in real big way. Thank you. I mean, I picked up your brain really well. I'm really going to do some of the things. Thank you. Thank you so much. Thank you.
There
Yes.
are many here who have dealt with similar experiences. Can you tell me what has been the most difficult thing in managing him?
Oh, that is lighting up the house in the night, middle of the night, like a Christmas tree. He lights up everything, and whichever room you are in, you can't speak. I mean, you can't sleep. And then, through the whole thing, he is so calm. Only I am excited. Because I am just waiting for him to put off at least one light. That is very difficult. So far, he has not become aggressive. He is agitated, yes, not aggressive. She had a first-hand experience on that day. He held on to her bag, never allowed her to go. And then, he didn't know when his grip actually released, he doesn't know. She had to actually sneak out of the house. So, all that can happen. But as long as you have people who understand, that there is a problem and this is what it can happen, when you have a community around you, that is very, very important. Support from the children. My daughters are my pillars. Support from the children is very important. You need to know that there is somebody at the back. Somebody has your back. Right now, I could not have come if my daughter hadn't stepped in. She is there at home taking care of him. And I have a boy who's there, but right now, I am dealing with a dementia patient and a teenager. That boy is 19 years old. He has his own teenage difficulties. So, it only adds to my pressure that not only a dementia, but also a teenager. So that is how it is in the house. Yes, it happens like that. I have actually, other than going for a walk after 9 o'clock in the night, when he goes to bed, that is my time. That is the only my time. In about 3 or 4 months, today is the day I have come out. Out of the condominium gate, I have come out only today, after some 3 or 4 months. You need somebody, you need to train them. Whatever you train them, an outside person cannot take care of them like how you do it. My sincere hope is that he passes away before me, so that I can take care of him until his last breath. I don't want him to be a burden for the children. Not that the children will treat him as a burden, but I don't want this responsibility to go to anybody else.
Thank you so much.
We can understand your emotions, and absolutely what you said is right. It is a disease not of the self, but the disease of burden is for the whole family. The family suffers rather than the individual. That is the way this disease is different from other diseases, where the patient knows that they are having a problem. Here the patient doesn't know, but the whole family suffers. And that is why the carer has a burden here. The carer burden is much more than the individual, and what she was telling was absolutely true. And it is extremely difficult for the people to understand them and cope with them. That is what every day counts, every minute counts, and that is how we always empathize with them, how they can look after such people. It is difficult. That is why we need to prevent rather than treat. And that is why we always say, prevent dementia, then treat dementia. How do we prevent? Modify the risk factors. That is what we always talk about.
Thank you so much. I now invite Dr. Yatish sir to give the token of appreciation to Mrs. Chitra Krishnamurthy.
Thank you, ma'am. Thanks for taking
And the courage, which probably I don't have myself.
See, one important thing, it's always comes to my mind is, I always connecting the dots, and what I found out is, my grandfather had similar kind of things. He has got literally all kind of stories. My mother and my sister and everyone used to say, your tata did that, your tata did this and all that part. Thing is, all kind of in the early morning hours, he used to do so much of drama in the house, like, we can recollect and see. What's good part is, we are all from village, Bam native place, from my roots, like, we have a community, we have like, cousins, sisters, brother, all of them, we are all there to support service. Support is so good, and nobody think about like, it is a disease, it's a burden, or it is something we need to take care. But by ignorantly, like, all of us are looking after him, taking care of him, but not as a medical condition labeled as dementia. But thing is, he behaves like this. Sometimes he is agitated. Sometimes, like, he throws tantrums. And his forgetfulness. All that part, like, I still remember the Sunti peppermint, like, he used to carry and give it to us. So that is another way of remembering. But most important takeaway message is the support group, like, we try to be like, as if the dementia is existing means, like, though not to be in a nuclear family, try to be as much as socially possible. That will definitely help us out in taking care of this and handling this. See, we are talking about caregiver stress. That is what madam going through. Thing is, her stress and the family stress is immense. Like, how can she can't even come out, step out, like, someone need to step in. So imagine that, like, how they're going to take care of kids. Anyway, thank you, ma'am. Thank you so much, right.
Slowly go down means improve, you mean. Improve. That is what I'm getting better means you need to work with them. And that is what exactly I was telling them. That yes. That is not possible. Yes. Yes. You can play cards, you can play what is that called, ladder, snake and ladder. You can play snake and ladder. You can play pagde. Pagde you can make, otherwise, I'm sure your family will know and they teach you. They will teach you, and we always ask them to help you with certain things. And that will help. And if you have to follow that, what they tell you, that improves a lot. That is what is important.
We have one more caregiver to share his experience, Mr. Santosh.
Hi, good evening. My name is Santosh. My father has been diagnosed with dementia and Parkinsonism from last 2 years. From seeing my father he's been doing yoga from last 70 years, now he's 82. So from seeing him doing headstands, doing all yogas, and now seeing him bedridden, it's really sad. The last 2 years have taken a big toll on our family. Like ma'am said, he doesn't know anything. It's us who feel what we're going through. There's not one single day or night where we think, why him? What happened to my father, who has been physically super fit, doing yoga, doing everything, and what happened to him? So that is also, that we have gone through that phase actually, yeah. And it's not easy. I mean, there is no, for us, we don't know what's going to happen tomorrow. So each day is a different day for us in terms of how to help him, how to take care of him. From, telling my mother that, okay, if he's doing his own work by himself, it's good. And then, okay, we have a caretaker. If he can walk by himself with a little help from caretaker, it's okay. And then from now, eating his own food, it's okay. And now, okay, let me, feed him, that's okay. And now through the Riles tube. So it's a very rapid deterioration that has happened. Like he always said, use the brain or lose the brain, or rest the brain and then rest the brain. That was what has happened to him. He only knew his activities was only yoga and exercise. He was not a person who would socialize or do some things. So that is one thing which actually had mattered a lot. If he had a lot of friends, maybe this wouldn't have happened to him. So yeah, it's not easy taking care of him, but then we have to. I mean, there's nobody else who's going to take care of him. So yeah, that's how it is.
I welcome Dr. Yatish to give a token of appreciation to Sister Santosh. We have a small token of appreciation for all the caregivers for giving such a wonderful doing such a wonderful work, caring for the patients at home. I would like to welcome Yatish sir to give the token of appreciation. Ms. Reshma.
We should always, I mean, when we take a break for caring your parent, so they should also be educated about what is dementia, because they sit there and say, why did you take break? It's not a maternity break, it's not. So how do we educate them? Is it some startup that should come in and educate people? So what do we do? Where is the gap? How do we bridge this gap? Because they can't empathize until they go through this process of taking care of their own parents. They don't realize. So how do we bridge this gap? I was trying to answer this question. That's why I was here. Right.
We need to do a lot more. That's the reason we are all here.
Right.
Government has recognized this already.
Yeah, Karnataka government of
Maternity leave now. The government is now giving a leave for the people who to take care of their elders. If you have a problem with dementia, if you are in a government service, there is a leave provided by them for 6 months, 1 year, like that. They do provide an extra leave, which is to support them. That has started recently, which is one of the thing in that direction. But the corporates we cannot say. The corporates we cannot say, but the government is already doing that.
No, I think in everything, the more we voice our concerns, the more our voices are heard. It's like how sir said taking care of a child. It's more than taking care of a child. People would understand if you're taking care of a 4-year-old. How many will understand if you're taking care of a 90-year-old? Exactly. And let me also highlight this fact. Caregiving is not just about taking care of your parents, it's about balancing with your other relatives also. Because the sibling or the child who takes care of the father or the mother would be undergoing the maximum stress, whereas the others will not. And often there are patients with dementia who will point to the main carer saying that he doesn't take care of me well. This happens. And the other siblings will actually point fingers, why aren't you taking care of my father? In spite of doing all this, my grandfather had dementia, and every time my aunt complained that it's so difficult to take care of him and there are so many problems here, he knocks at our door in the middle of the night, he accuses us of doing this, that. Even my mother and her sister all said, she's lying. My dad isn't that way. So, not only are you doing more than what you can, you're being blamed for things, for doing everything. So, it adds to all the stress too. It's not. Exactly. So, true. You don't have to prove to anyone, because if you're taking care of your parents in the best possible way, a person with dementia, nobody can understand it better than than you. No one else can understand it. So you, at best, you can tell you do not know what I can do and what you can do. So let me do what I'm doing. One day, not 1 day, 1 hour. 1 hour they'll not be able to. So it's a different thing. So which is why we need to voice. Our voices have to be heard. Only then changes will happen. There was a time when people used to talk about dementia like dementia. Oh, that's an old age disease. That's something that happens to people 95 years above. But now it's so common. We are sitting here talking about it.
I'm more than relevant to your job profile. I can achieve more. I can be more productive because I've gone through a lot of things. So why not? I would be saying that I would be the best candidate because I've already gone through. I've had my learnings. I'm still strong. I'm resilient. Everything. So, but they don't understand what dementia is, right? So they can't assess. So we have to bridge this gap. Correct. It's a slow process. Until then, we are going to lose our resources, right? So our time will go. That's where I'm just thinking of how do we bridge this gap?
Yeah, it's a slow process. Probably not in our generation.
Thank you. We didn't have AI a decade ago. We have it now to do a lot of, so it will definitely come. I would like to call Ms. Sushma.
Thank you, ma'am. Thank you so much. Thank you for. So we need to make all of you as heroes.
Caregiver champions.
Probably, madam voiced out everything, whatever we are, being a woman, whatever facing. The thing is, we cannot leave hope. We cannot see them going down, but still we have to push the days and see how things go far. That's it. Thank you.
Ms. Mamata Shivani.
Good man. Thing is, Tom is coming and whispering me that many people are there. He said, like, no, all of them need to be on it.
Ms. Ankita. T. Subramanian.
He should be allowed to speak. I think he's the oldest caregiver here.
I don't know, I have not come prepared to give a speech. Mine is a very peculiar case. My son, who is around 43, highly intelligent, very accomplished professional, chip design, the cutting edge, a very strong athlete, cyclist, cycling 100 miles, climbing mountains 14,000 feet, many peaks. Suddenly he has contracted this dementia. While in USA itself, it was diagnosed. It was not diagnosed as dementia at that point of time, but forgetfulness were there. And his boss was noticing certain mishappenings. He will be forgetting where he has parked his car in the shopping center, like that. But he was so good in his job. He was indispensable for his company. Even though it was an American company, they kept him for a long time. Because of COVID, we could not reach there. We didn't realize. On the phone, we could not understand that something is wrong. We didn't realize. Because no flights, he could not come, we could not go there. I don't know, I should ask you, doctor. At that point of time, he underwent severe malnutrition, I think. Probably that also triggered this. But finally, it is seen as some genetic modification, genetic mutation. But God is great. We could reach there, bring him back. Now we are taking care. The greatest worry is after us, like Madam what she was telling, older people falling dementia situation is a little bit sort of a set pattern. But in our case, it's a strange pattern. So I don't know really what is in store for us. Fortunately, our family is together, and granddaughter is there, daughter-in-law is there, my daughter, my wife. He had a stroke subsequently here. There also the God is great. Very timely we could rush him to Manipal Whitefield, and he was given a very good treatment. And any illness, it is aggravating the situation further. So that is how we are dealing. We are learning, like what Madam was telling. Every day we are learning.
Thank you, sir, for your valuable insights. And I think let's all give a huge applause to sir.
We understand the problem what he is facing. An elderly gentleman coming with his son. So sometimes we also have a situation like this. But it is rare. It is a very rare, sir, what you are going through. But it can occur. It can occur at a younger age. But fortunately, God is great. That is less than 1 or 2% of the cases. Most often it is elderly. That is one thing which we are happy about it. That is what my colleague from cardiology used to say. That earlier, the son used to bring the father for the cardiac diseases. Now it is, the situation is different, that the father brings the son to the hospital for cardiac problem. What do we say for this? Yes, there is a changing scenario in the cardiology. It may be because of the stress, because of the situation, what lifestyle changes which has gone on. But fortunately in dementia, so far, we have early onset dementia, but it is extremely rare. And those rare diseases, we have to live with it. And God will give you enough strength to bear that. That's all we can say, sir. And the community should support you. And wherever it is possible, whether it is medical or non-medical, we are all with you, sir. Thank you, sir.
Thank you, sir. I would like to invite Mr. Simanchal Pandey. Mr. Simanchal, on behalf of Ankita. Sir, आप ही आइए. Huh. Thank you so much. Mr. Madhu? Miss Asha Rani? Mr. Ujjwal Sohas? Okay. Miss Balakrishna?
I don't take much of your time. See, my age is 48, 49 years, and my mother is 90 plus. Okay, it's really challenging. What happened, like she was with my sister for a long time years, where she was locked up between four walls. Eating, sleeping, eating, sleeping, and no TV to watch, nothing. So after a lot of fights and all, we brought her out from that jail. Then we brought her to doctor. Then doctor diagnosed with dementia. I was totally tensed what to do, how this works and all. Later, I started researching online also. Dr. Steve sir and Harida ma'am helped me a lot how the patient is. Literally, like I was like totally tense to take care of her. Like what she's doing, why she's behaving like this. I used to get angry. Then once I visited the Nightingale, I just sat there for more than 2 hours. Then I got some information how to take care of this dementia patients. Then immediately I started reacting for that. First of all, I changed the aura. Like what she was wearing, the old nightie, I just changed it to changing her to wear dresses. She started feeling happy. I can see the glow in her eyes. Then slowly I made her to do exercises. I have so many videos of her doing exercise. She used to engage doing exercises where I keep talking with her like a small baby, how we take care when we give birth to the baby. I keep engaging her in all the activities. As you said, sir, pagde. ನಾವು ಕವಡೆ ಆಡ್ತಾ ಇದ್ವಿ, ದಾಯ ಆಡಿಸ್ತಾ ಇದ್ದೆ, ಕವಡೆ ದಾಯ ಮತ್ತೆ ಲೂಡೋ ಆಡಿಸ್ತಾ ಇದ್ವಿ, ಮತ್ತೆ ಐಪ್ಯಾಡ್ನಲ್ಲಿ ಕಲರಿಂಗ್ ಮಾಡಕ್ ಕೊಟ್ರೇನು ಶಿ ಯೂಸ್ ಟು ಡೂ lot of activities. There is no 1, 2 or 3, lot of things. And exercise also, at this age also, even though sitting on a chair, she comes, yes, I will do, you teach me. That is that energy she has. But the thing, little healthy she is, she can't walk freely, the slow steps she takes. But if I tell everyone, I know we are facing the challenges, but we should face it very happily. We should not treat them as a patients. That's the main thing. More than a patient, we should think they are also among one or a baby. We are taking care of a baby. So in that way, we can enjoy and take them to temples. They too will enjoy. Take them to some parks. So they will see the children playing around. They'll ask and throw the ball. Yesterday, we used to play throwing the ball each other and a ring. They will catch and they will throw us back. And it's a puzzle. It's a puzzle, like pieces. So they have that a bit of piece memory. That is the thing they have right now. Those memories we have to hold and go along with them. And we have to make them to generate those memory back again and create that environment so that they will feel happy. And they will come back to life. So this is the age where sitting next to them, asking what their needs, wants, if they want to visit somewhere, their relatives' house, though we have lot of misunderstandings between each others, we have to go, we have to take her, and we have to fulfill her wishes, because she is 90 plus. So this is my condition. Thank you for listening to me for a long time. Thank you so much.
Very, very useful, ma'am.
Thank you so much for sharing your experience. I would like to call Mr. Rohit Fernando.
I have been taking care of my grandfather since my father is away from home, and I would say it was very difficult for me and I actually to convince my grandmother and take care of him was the very biggest task. And as ma'am was sharing, I was on a career gap also, and I have gone through a lot, and I used to go through this evenings when my cousin's father, mother and my aunts and all used to come, and they used to give comments like we are not taking care of him properly, and those were the things which really bothered me, from morning to evening, and we've been there for him, with him, but the relatives talking about us, this is what bothered us a lot. Thank you.
Thank you for sharing. Mrs. Bhagyalakshmi. Thank you, sir. So as Rosalyn Carter once said, beautifully said, there are only 4 kinds of people in the world. Those who have been caregivers, those who will be caregivers, those who are caregivers, and those who will need caregivers. Thank you so much for all your support. I would like to welcome Dr. Steve for giving the vote of thanks.
I think this is the first time we've had a session on focusing on the needs and the trouble a caregiver faces. And truly, they are the champions. There is unnecessary and unwanted rewards and honors being given to doctors to diagnose dementia, but it's actually the caregivers. They are the soul and they are the heart. And if not now, someday we will all be caregivers. If not for a patient with dementia, for somebody else with a medical illness too. As older age advances, as longevity increases, more awareness sessions and changes will happen across. It's happening in India. When I started talking about geriatrics, we were at 9% of older people comprised only 9% of the population way back, compared to UK then, which was about 14%. Today, in India, Kerala stands at 15% of older persons. This is much higher, and we are going to face a situation where we have to build up our resources and make changes, which is why we've been active in many fronts. We have the Nightingale Center, we have Dementia India Alliance, we have the Indian Academy of Geriatrics. This is all blossoming into a better future, at least for us, maybe when I'm old. And I hope as we become old, we'll be taken care of better. If that happens, we are lucky. It may not happen in this generation, but definitely for the next generation. For this event to materialize, we've had to seek help, and I owe all my thanks and gratitude to Apollo Hospitals. Dr. Yatish has been very helpful in this. He said it has to be not small, it has to be a big way, and let's even have a live streaming, and it's been possible. I thank the marketing team, I thank the hotel organizers, and I thank Seniors First, and my department, Ms. Harida, Dr. Nadia, Krishnaveni, and Harini, all and the Seniors First team. I hope I have not missed anybody else. Alfias, everyone. All of you, thank you for this event, or this would never have been a success. Thank you.
But most important thing is, I need to say, tell about Dr. Steve, who has taken this initiative, and he has put it across. We need to do this, and it is. But all my own submission and request is, please form the groups, be a bit more active, vigilant, and spreading this message across. We need to do whatever. On one side, doctor side, on the side, caregivers, other side, family, and each one of us need to come to the platform and talk about, it has to be a voice, as rightly put across. We need to make, ourselves and become a powerful voice. We are, not only just the caregivers, we are here to take care of larger community at large. So we need to build an ecosystem where there is no support as of now today. It's our duty to build that ecosystem, and thank you so much for each one of you, particularly Dr. Steve, for taking this initiative and making it a huge success. Thank you. Thank you.
Special thanks to Dr. Satish Chandra. Without his insight and his experience spoke a lot today, sir. Thank you so much. And thank you, most importantly, to all the caregivers who made this happen. When we came in, I was worried if we would have enough of people, but I think we've had a truly wonderful session. Your experience will speak volumes to the rest of them who are scared to even speak about it. Thank you, everybody.